Hematuria, or blood in the urine. What does it mean? One of the main reasons to test for blood in the urine is to screen for possible abnormalities in any of the urinary system organs. For example, kidneys, ureter, bladder, and urethra. Hematuria can be two types. Microscopic hematuria, when the blood cells found on the urine test, and macroscopic, meaning you see the blood in your urine with your naked eye. Let's talk about microscopic. When you do urine dipstick or urine test called urinalysis, there is a section called blood. But that particular item is not clinically significant. The trace amount of blood can show up for multiple reasons. One of the most common one is contamination. What's important is to look at RBC, red blood cells, in your test. And you can see the exact number of blood cells that was found in your urine sample. Anything more than 3 considered to be abnormal. And again, we need also to take in consideration, were you on your period? If you just recently had a procedure such as sling, prolapse repair, cystoscopy, any procedure on your urinary organs, you will have some trace of blood, some small amount of red blood cells in your urine, which is normal. Some of the biggest concerns is cancer. And it's a really good screening test, very sensitive screening test. Depending on your prior medical history and your current medical conditions, urologists will be able to determine what kind of workup is necessary. There are a few factors that we use to assess your risk for having an abnormality. Age, your smoking history, and amount of red blood cells in your urine. You would be considered a low risk if you're a woman younger than 50 years old with less than 10-year history of the cigarette smoking, and you have about 3 to 10 red blood cells in your urine test. In those cases, it's reasonable to observe and repeat urinalysis in about 6 months. However, not everyone is comfortable with just observing when they have a blood in the urine. In those cases, it's reasonable to do cystoscopy to evaluate the bladder and ultrasound to rule out any possible abnormalities in your upper urinary system. If you belong to intermediate risk, it means that you're a woman between age of 50 and 59, have a history of 11 to 30 years of cigarette smoking, and have a red blood cells between 11 to 25 cells. So in those cases, you will definitely receive cystoscopy and ultrasound to evaluate your kidneys. If you're considered to be high risk, so you're older than 59 years old, you have smoked for longer than 30 years, and you have more than 25 red blood cells in your test, it means that you should receive a CT scan of your kidney, ureter, and bladder, and cystoscopy. Some of other benign causes of the blood in the urine is urinary tract infection, kidney stones, and some vascular abnormalities. In majority of cases with microscopic hematuria, we find nothing, which is a good thing. In those cases, you need to talk to your doctor what will be your plan for follow-up. And there could be different options. We call it shared decision-making based on your concern, your history, and provider recommendations. So what if you saw the blood with your naked eye in your urine? One of the most common causes for that to happen is urinary tract infection. So if you see the blood in the urine, make sure to see your primary care, go to emergency room and check your urine and make sure that they check the culture to see if there is actually bacteria that causes the infection. And blood can appear differently in the urine. It could be clots, it could be bright red or dark red color. So anything that looks abnormal, it's very much reasonable to see your doctor and do the urine test. If your urine test comes back negative for infection, it's a clear indication that you do need to see a urologist and get a full workup and determine where the issue is coming from, because based on that, we will be able to address it appropriately and the treatment options are different. The popularity of the home urine tests are growing, but it's a huge difference between the home testing and urinalysis. Home test can give you false positive for many different reasons. Urinalysis is more reliable and can determine all type of cells that are present, and if there is a bacteria, the urine culture test can be added to check for possible urinary tract infection and identify the specific bacteria that causes the infection. So if you get a home dipstick test positive for blood, make sure to follow up with your primary care to get the formal urinalysis done, because with that test, you can actually confirm or rule out the presence of the blood cells in your urine. So if you were told that you have blood in your urine, it's not time to panic, but it's definitely time to see your urologist and get all the tests done.